Good afternoon. My name is Jennifer Sorrell, and I'm the Executive Director of the UCI Anti-Cancer Challenge. Thank you all so much for joining us today. If you'd like to ask a question during today's session, please use the Q&A feature at the bottom of the screen. Next slide. Next slide, please. Our moderator and first speaker for today is Dr. Kim Hecht. Dr. Hecht is currently the Ambulatory Medical Director of the Susan Samueli Integrative Health Institute. She earned her medical degree from the College of Osteopathic Medicine of the Pacific, where she did an additional predoctoral teaching fellowship in osteopathic manipulative medicine. Dr. Hecht completed her traditional internship at the Downey Regional Medical Center and her residency in physical medicine and rehabilitation at UCI. Dr. Hecht is very passionate about supporting patients that suffer from pain. Her mission is to partner with her patients and their families in order to provide a whole person approach to improving not only pain and function, but the quality of their lives. Dr. Hecht blends a broad range of integrative healing modalities to assist her patients through lifestyle recommendations, hormone replacement therapies, supplements, medical devices, osteopathic manual therapy, and injections. She is also able to address the varied and complex needs of her patients in collaboration with the other clinic providers and colleagues, including physicians, mindfulness practitioners, nutritionists, acupuncturists, massage therapists, yoga therapists, and physical therapists. I'll now turn it over to the esteemed Dr. Hecht.
Thank you for the kind introduction. I'm so excited to be here and very honored to be asked to be speaking on this very, very important topic of pain. Today, I will specifically be talking about cancer pain and cancer-related pain, which I will, start to elaborate on in my following slides. Next slide. So in general, if you have got a diagnosis of cancer and had a tumor, you may have had surgery and encountered post-surgical pain. And there are a number of things that can cause pain after surgeries, including removal of lymph nodes. And at that time, once your lymph nodes have been removed, it does impact, the circulation of your lymph, and that area may become swollen, and that swelling may lead to pain. Additionally, depending on the size and depths of your scars, there may be scar thickening and fibrosis. In women that have had breast cancer, it is very, very common to experience arm pain following surgery, and some of it might be related to fibrosis of the scars, in addition to other types of cancers. Also, during the surgical procedures with, the tumor removal, there may be injury to nerves. And that can lead to numbness and tingling, but it can also lead to pain as well. In some patients that have had removal of pelvic organs, this can impact their bladder function and bowel function, which may also lead to pain as well. Next slide, please. So specifically for cancer patients, in addition to surgery, you may be undergoing chemotherapy. And some chemotherapy agents can cause neuropathy. So what are the typical symptoms? They may be tingling, burning sensations in your fingers and toes. It can begin weeks to months after initial treatment and peak at or after the end of treatment. Sometimes the pain and the tingling may completely resolve after chemotherapy is stopped, but sometimes chemotherapy-induced peripheral neuropathy is only partially reversible, and in some cases it may be permanent. Next slide. So what can we offer for these different types of pain, whether it's post-surgical pain or if it's chemotherapy-induced peripheral neuropathy from an integrative perspective? Well, we really do like to utilize the mind-body-spirit approach. And part of that may include mindfulness, relaxation and imagery techniques such as hypnosis or cognitive behavioral therapy. Next slide, please. So in terms of mindfulness, many of you may have been exposed to some aspects of mindfulness in your daily lives and have heard of mindfulness-based stress reduction. We offer many classes here at the Susan Samueli Integrative Health Institute online, and hopefully coming soon in person again. Next slide. So in order to understand mindfulness, it is important to look a little bit at the neuroscience of mindfulness and how it will impact your health. So there's areas in the frontal part of your brain, particularly things like the prefrontal cortex, where that help you to make decisions and to concentrate and focus. Areas like the insula are part of regulating your emotions. Next slide. And then I didn't mention the amygdala that was on the other side, but that is also part of the emotions as well. So the anterior cingulate cortex is associated with attention and changes in activity and our structure in response to mindfulness meditation. So in our daily lives, we may find that we're distracted by our various devices, whether it be iPads or computers or tablets. And mindfulness helps us to pay attention on purpose to various things that may help mitigate some of your pain. It also can help improve emotional regulation and reduction of stress. There has been studies that have shown that increased stress and detrimental emotions such as anger or sadness can lead to increased perception of pain. And so mindfulness also works on those structures to help us to regulate those emotions. So in general, mindfulness helps us to focus in the present moment so that we can appreciate other sensations that may be non-painful, or take a different perspective on our sensations so that it becomes less stressful to us. Next slide. There have been studies on mindfulness to treat pain in cancer patients. There were 10 randomized controlled studies. This was done very recently in 2021, this review, where 843 participants were included. And they found that in subgroups of people who practiced mindfulness, it was effective in reducing the pain intensity. It was a small size, but usually in my patients, I tell them that every little bit counts. And so if you are interested, there are a lot of other resources on our websites that can direct you to learn more about mindfulness. Next slide. Here again, you can see on this slide where they spell out the different 10 studies, and you can see that in general, where the green squares are, that there is more favoring of pain control if you have done mindfulness-based interventions. Next slide. Another mind-body therapy that's very popular is hypnosis, and it has been shown to control not only pain, but nausea, fatigue, discomfort, and emotional upset at the time of discharge in 200 breast cancer surgery patients. Another randomized clinical trial of 124 women with metastatic breast cancer showed that it was an effective treatment for pain. And then in general, randomized study of 201 cancer patients, it was also shown to be beneficial for pain. Next slide. Cognitive behavioral therapy. In general, when I recommend any of these mind-body therapies to my patients, I recommend multiple ones because I think that they all work slightly differently. So mindfulness helps us to train our attention, and it helps us to regulate our emotions. Cognitive behavioral therapy further helps us to regulate our emotions by examining the type of thoughts that we have and rewording some of the phrases that we like to tell ourselves. There are a lot of different types of techniques in cognitive behavioral therapy that involve, cognition, which is changing the thoughts that you have by changing the words that you tell yourself. Instead of saying things like, I am depressed, you might say like, I have sad feelings. And so therefore you don't associate the sadness completely with your identity, which may make you feel worse. There's also exposure therapy for anxieties or phobias, and also things to do like positive reinforcement to help you to do like a more desired behavior, like to improve your diet or to increase exercise. So in general, I usually recommend a combination of these different types of mind-body therapies for my patients who have pain. Next slide. Here we have an abstract of a study that looked at cognitive behavioral therapy for distress and pain in breast cancer patients. It was a meta-analysis that looked at 20 different studies, and they did find that there was a positive benefit for cognitive behavioral therapy in these patients. Next slide. Now, once we've talked about things that you can do yourself, or in a group or on an app, which includes the mindfulness and hypnosis, then we also discuss different manual modalities that may help patients with pain. A lot of patients that have cancer seek out massage therapy, and it is very widely used along with aromatherapy in palliative care. So this systemic review of some randomized controlled study looked at 22 different trials in almost 2,000 patients, and they did find that, compared to usual care, massage and aromatherapy reduced anxiety, pain, and improved a quality of life a little bit in some of the studies, but overall it was inconclusive. There was some evidence, though, that the active control reflexology reduced some pain. Next slide. For my patients that have lymphedema, many of them are very aware of manual lymphatic drainage. We do provide that in our clinic as well, and it is usually employed to help women who've had breast cancer and surgery to reduce the swelling that they may have in their upper extremities. So this study looked at 31 women with breast cancer related lymphedema, and they showed that manual lymphatic drainage was able to reduce the size of their arms as well as their pain and heaviness. In a different study of 42 women with similar types of problems, they found that compression garments with manual lymphatic drainage versus just compression garments alone did not offer additional improvement in the lymphedema. Next slide. One of the things that you should be aware of if you do want to get massage are the contraindications. So in general, if you have some kind of blood disorder where you have very low blood platelet counts, you're on blood thinners, then you want to avoid deep tissue massage, and you might want to go for some lighter pressure massage. Manual lymphatic drainage is a light touch type of massage. So in that case, it would be possible to get manual lymphatic drainage, but try not to get deeper tissue massage like Swedish massage. Also, it is a concern if there are metastases to the bones because of risk of fracture. So again, it is important if you do want to seek out massage therapy, that the areas that you have metastases are known and that lighter pressure is used over those areas. And then common sense is if you have any kind of open wounds or dermatitis, you definitely want to avoid any direct massage over those areas. Next slide. So another type of therapy that you can use for your body is acupuncture. And acupuncture in general, it has been studied in the United States since the 1960s. And some of its properties are similar to taking an opioid medication. In fact, they have found that when you do electroacupuncture at 2 hertz, it can increase the release of enkephalins, endorphins, and endomorphins, which are opioid-like molecules. 100 hertz selectively increases the release of dynorphins as well. So sometimes there's combinations of different frequencies that can be used to improve the therapeutic effect and decrease pain. A lot of these studies have looked at various types of chronic pain issues, including low back pain and diabetic neuropathy. The studies were able to find this mechanism by looking at naloxone, which is an opioid blocker, and found that, giving animals naloxone can block the analgesic effect of electroacupuncture at the lower frequencies, but not at the higher frequencies. Next slide. Acupuncture has been studied in chemotherapy-induced peripheral neuropathy as well. And this one is a literature review from 7 different databases through August 2019. And they did find 6 randomized controlled studies with a total of 386 patients, found that it was effective in relieving chemotherapy-induced peripheral neuropathy. So many of these patients might have had different types of acupuncture applied. Not all of it is electroacupuncture, but it was shown to be beneficial. Next slide. Once you've done the mind body kind of therapies where you have calmed your mind down and you looking at acupuncture or massage, there are other things that you can do for yourself and you can do in conjunction with a provider, which is, look for vitamin deficiencies. And I'll discuss them in the next slide. There are specific vitamins that can impact nerve health, which may impact your pain levels as well. Also, if you have certain comorbid conditions like diabetes, that might also impact your response to surgeries and chemotherapy. Next slide. So in general, it's important to know that many of the B vitamins are very, very important for nerve health. So damage and regeneration naturally occur in the nervous system. B1, B6, and B12 are very key players in maintaining your nerve health. First of all, they do protect against damaging environmental effects. B1, which is thiamine, is a direct antioxidant. It has been studied in diabetic neuropathy and shown to be helpful for that. B6 balances nerve metabolism, and B12 maintains the myelin sheath, which is the coating around your nerves. Nerve injury can occur at times, and so if anyone has, whether it's through surgery or chemotherapy damages to their nerves, then these vitamins will play a role in regeneration and helping to, heal the area. Furthermore, B1 also facilitates the use of carbohydrates for energy production, and B12 promotes nerve cell survival and remyelinations. So absence of these vitamins will favor permanent nerve degeneration and pain and can lead to peripheral neuropathy. So these are very, very important vitamins. Next slide, please. There is an association between neuropathy and B vitamins. In my practice, I do see that some of my patients that are vegan may not get enough B vitamins. And so that in and of itself can be a risk factor for neuropathy. Another risk factor for neuropathy is diabetes. So this just looks at general neuropathy and B vitamins and did a meta-analysis of them. And they found that, people who did have neuropathy with low B vitamins, when treated with certain B vitamins like B12 and B1, did have improvements of their symptoms. Next slide. There are certain medications that you should be aware that can deplete your B vitamins. These ones are listed for B12, but they may also deplete your other B vitamins as well. Colchicine is very often used for gout. Chloramphenicol, that's not a very common medication. Alcohol impairs the absorption from the intestines. Any type of histamine 2 receptor antagonist. So if you have some type of allergies, metformin, which is used in diabetes, and proton pump inhibitors, which are used in reflux. So many of these medications, if you are taking them long-term, may put you at risk for having some B vitamin deficiencies. Next slide, please. So before I talk specifically about this particular slide and the study that it's related to, I will say that some patients do know about B vitamins affecting the nerves and will take supplements. And there is controversy about taking supplements, especially during chemotherapy. It is also known that taking too much B6 can also cause nerve damage. So there is a fine line between having too little B vitamins and taking too much. And this is one study that illustrates some of the dangers of taking too many supplements that many of your providers might caution you against taking, especially while undergoing treatment. So this study specifically looked at breast cancer patients and dietary supplement use. They had a questionnaire for patients on a number of different supplements, including the B vitamins, CoQ10, vitamin A, vitamin C, vitamin E, and the carotenoids. So they sent these questionnaires to these patients to see if they were taking them before, during, and after their chemotherapy treatment. And what they found was the patients that took iron and some of the B supplements unfortunately had some recurrence of their cancer after. So that is, my caution about taking supplements. Next slide, please. So the safest way to get your nutrients is through foods. And I'll be talking about some of the different food sources from B vitamins. As I said before, it is known that taking too much B6 vitamins, which is usually in the different types of B complexes, can contribute and worsen neuropathy and nerve pain. And so we don't want to do that. And because of the cancer diagnosis, patients should be cautious about some types of different vitamins, as I mentioned before in the last slide. So the best way would be to try to get it through food. So next slide. Some food sources for B6 would be through liver, tuna. My only caution with tuna is there is elevated mercury in tuna, salmon, fortified cereals, chickpeas, poultry, some vegetables and fruit, especially dark leafy greens, bananas, papayas, oranges, and cantaloupe. And so it is important that, if you are interested in adding some of these foods to your diet, that you also might want to speak to an integrative health practitioner, whether it's a nutritionist or a naturopath or a physician that specializes in this, because again, these are the list of the different food sources for B6, but it might not be appropriate for your specific case. Next slide. B9, which is folate, the different sources of that include dark leafy greens, turnips, spinach, romaine lettuce, asparagus, Brussels sprouts, broccoli, beans, peanuts, sunflower seeds, fresh fruits, fruit juices, whole grains, liver, seafood, eggs, fortified foods and supplements. And, for this particular side, I would say, in general, for my diabetic patients, I do not recommend fruit juices because that can raise their blood sugars. And some of my patients that have irritable bowel syndrome or gastrointestinal problems may not be able to tolerate some of these foods. So again, if you have other conditions, it may be good for you to talk to other integrative health providers about what food choices might be best for you. Next slide. And then finally, sources of B12 include fish, shellfish, liver, red meat, eggs, poultry, dairy, milk, cheese, yogurt, fortified nutritional yeast, breakfast cereals, soy or rice meat. And so a lot of these different food sources include red meat, and that might not be something that we would recommend too much of if you have heart disease. So, you know, take all of these different recommendations with a grain of salt. Next slide, please. There is one supplement that I typically do recommend to my patients to help with chemotherapy-induced peripheral neuropathy specifically. And sometimes I also recommend this amino acid if they have sores related to chemotherapy, or they have some gastrointestinal problems. So what is L-glutamine? It is an amino acid that is involved in cellular energy and nitrogen donation. So there was a study of 86 patients. I'm going to talk about this amino acid in a couple of slides to see if L-glutamine was helpful in preventing chemotherapy-induced peripheral neuropathy in colorectal cancer patients treated with oxaliplatin. And so they took about 15 grams twice a day for 7 days, every 2 weeks, starting on the day of their infusion. And what they did find was that by adding L-glutamine, that interference in activities of daily living was lower compared to the group that didn't take it, and the need for oxaliplatin dose was lower as well. There was no significant difference in between the groups to chemotherapy, which is a good thing. There was also no significant changes in their nerve conduction studies. But, you know, the patients did find a benefit in reduction of grade 3 to 4 neuropathy after 4 cycles. So it was helpful for these patients in reducing severe neuropathy. Next slide. It has also been studied in patients that have taken paclitaxel, and those patients had less weakness, less loss of vibratory sensation, and less toe numbness. Next slide, please. It has also been studied in kids and adolescents with cancer as well that were treated with vincristine. 49 patients were evaluated, 100% developed neuropathy. And what they found was that the scores, the children that took L-glutamine rated their quality of life as improved compared to the placebo group. So it's well tolerated. It is associated with some improvement in their sensory function and overall quality of life. Next slide. Another supplement I also recommend to my patients that have chronic pain, peripheral chemotherapy-induced peripheral neuropathy, fibromyalgia, is PEA, which is also called palmitoyl ethanolamide. It has an endocannabinoid-like ability to indirectly activate the CB1 and CB2 receptors. And animal models have shown that it reduces pain and inflammation following sciatic nerve injury. Next slide, please. Sometimes supplements, acupuncture, mindfulness is not enough to help my patients with their pain. And I do want to try to avoid some oral medications for them because of the side effects of some of these types of medications. And so I will prescribe some of my patients compounded topical creams. The typical ones that I include in the topical creams are gabapentin, ketamine, amitriptyline, and baclofen. There was a double-blind placebo-controlled study of 208 patients with chemotherapy-induced peripheral neuropathy, and they found that the topical gel that was made out of baclofen, amitriptyline, and ketamine was helpful in reducing their pain, tingling, and cramping. So baclofen is typically a medication used to reduce muscle tension and spasticity, but it also acts as a GABA receptor agonist. Which is kind of calming to the nerves. Amitriptyline is a antidepressant, and it works on the sodium channels and adenosine A receptors. Ketamine also it inhibits the NMDA receptors, which is related to pain. So usually it's different types of combinations of these medications that I will prescribe to my patients to help them with their pain. Next slide. All right, well, I have finished my portion of today's lectures, and it is my great pleasure to introduce Dr. Sandy Colvard. She holds a Doctor of Naturopathic Medicine from Southwest College and a Bachelor of Arts in Neuroscience from Smith College. Prior to her position at UCI, Dr. Colvard served on the executive leadership team as the Director of Integrative Training for CHI Healthcare and served as the naturopathic physician at Cancer Treatment Centers of America. She is board certified as a fellow of the American Board of Naturopathic Oncology, and she has treated all types and stages of cancer and holds unique expertise in hematologic cancers and autologous stem cell transplants. Dr. Colvard has honed her specialty through private practice as well, and specializes in anxiety, depression, hormonal imbalances, autoimmune conditions, and neurology. As an educator, she has served as the attending physician to primary care and oncology residents and was previously appointed the clinical science faculty at SCNM. So please continue, Dr. Colvard.
Thank you, Dr. Hecht. Can you hear me okay? We good? Okay, good. So hi, everybody. Good afternoon. I'm here today to talk to you about nutrition and cancer. Specifically, I was asked to talk about the prevention of cancer, but I want you to know that almost everything that I'm going to speak about today is also applicable if you have a cancer diagnosis. So let's jump right in and start talking about food and nutrition. Next slide, please. So there's lots of confusion about this, right? When you go to the internet, you're going to have, or go to the store, you're going to have health food people telling you that you have to do this diet or you have to do this thing if you want to lose weight, if you have cancer, et cetera, et cetera. So, and a lot of them don't really have medical knowledge or even a nutritional education. And a lot of them recommend the same thing. No matter what condition you have, they're going to say everybody has to do this diet. Unfortunately, there are some oncologists, although it's not as much as it used to be. I can certainly tell you that, and I'm so grateful that some oncologists tell their patients, it doesn't matter what you eat whatever you want to, because it's not going to affect your cancer. And then, of course, our good friend, Dr. Google, that we look at on many occasions to look things up, to do our research. Next slide. So nutrition, as I'm sure everybody knows, is an issue for cancer patients, even after treatment is over. We had a study of approximately 2,000 or more patients that had cancer. 91% of them had some sort of nutritional impairment. 9% of all those folks were actually overtly malnourished, so they weren't getting what they really needed. 43% were at risk for malnutrition, and 40%, and in my experience, it's sometimes more than 40%, are actually, they don't have an appetite. They've lost their sense of taste. Things taste differently after chemo. So we do have to worry about nutrition when it comes to cancer. Next slide. So I love this slide. I have to thank my friends here, our registered dietitians here at the Samueli Center for this slide. This is the perfect picture of the standard American diet. We see our burgers, we see our chips, we see pizza, and there's a reason that standard American diet spells sad. So next slide. So these next couple of slides are just illustrative of how people eat in different cultures or different areas of the country. So if we take a look at the standard American diet, 62% on average are all processed foods. They're bad oils, they're sweets, refined grains, et cetera, et cetera. We only have, less than 2.5% that are whole grains, so like real food, and then unrefined plant food. So fruits and veggies, 10%. That's it in the standard American diet. And then look at the amount of meat that we eat. 25% or more of our meals are, meat-based. So then there was something called the Blue Zone Project. And so they looked at different areas of the world called the Blue Zones, where people lived to be 100 years old or older. And they looked at what was the difference. One of the many factors they looked at was what was the difference in their diet. So there's a section of Loma Linda, California. So these are the 100-year-old people in Loma Linda, and this is how they changed their diet. So if you take a look, we've got 33% veggies, 27 fruits, legumes, and soy. They've got some dairy in there. And then look, 4% meat and poultry and 7% whole grains. So the illustration, it's pretty dramatic. I think you would agree with me. Next slide. And then they looked at other areas of the world. So in Greece, and so I think what I'd like you to notice here is that it's not all standard. Not every area that has 100-year-old people are eating the same sort of diet, but there are some similarities. If you look at Greece, only 5% are eating meat. 5% are doing pasta. There's a lot of greens, a lot of legumes, potatoes, et cetera, a lot of olive oil in the Greek culture. In Sardinia, Italy, you're going to sit there and say, what? They're doing a lot of grains. But if you think about it, in Sardinia, Italy, they are making their own pasta. They're using whole grains and making it on site. So this is not going to the store and buying the box of whatever pasta that you buy in the store, and then you look at, again, 5% of meat and fish. Next slide. So one of the questions I like to ask a lot of my patients is, how are you shopping? What are you doing when you go to the grocery store? And so then my answer is, how should you shop? And it's all about the perimeter. Many of you probably already know this, but the real food, the fresh food, is on the perimeter of the grocery aisle. That's where the produce, the dairy, the meat, even sometimes the bakery and the whole grains are there. The middle aisles have all of the things that are processed. And so I ask you, when you buy something that's processed from a middle aisle, what's the shelf life? What's the expiration date? If it's good for the next 2 to 5 years, is that really real food? Good question, right? Next slide. So these are just some basic shopping tips. I'm sure everybody here does this. Sometimes we don't. I know that sometimes I just run out and shop and I don't have a list or anything like that. But when we have time to plan, have a shopping list. Don't shop when you're hungry. We've been told that. I know my mother and my grandmother told me that years ago. It's really interesting to think about buying what is in season. If you're on a budget, look at what's on sale, but what's in season. There's a great thing in Chinese medicine where we talk about eating with the seasons. For example, we shouldn't be eating the same thing year round. So in the winter time, according to the tenets of Chinese medicine, we should be eating those things that are bringing us closer to the earth. They're keeping us warm during the winter months. So we're talking about soups and stews, root vegetables, all of those things that are bringing us back into the earth. And then as we go into spring and summer, that's when we're really having a lot of salads and fresh veggies and a lot of raw veggies if we're able to eat that. I really encourage people to look at your farmer's market and be able to ask when you go to a farmer's market, like, is this organic? Because sometimes they don't have a sign up that says, well, we're an organic market, but a lot of the folks at the farmers markets are actually growing their food organically. So just something else to think about. And then the question of organic, do I have to buy everything organic? Next slide. The answer is actually no. You don't have to buy everything organic. So if you go to the website of the Environmental Working Group, they have something called the Dirty Dozen and the Clean 15. So the Dirty Dozen is that list of 12 fruits and vegetables that have been tested, and if they're conventionally grown, they have so much pesticides on them that it would be much better for your health to buy those particular items organic. And a note here, potatoes are usually always on the dirty dozen. So in 2022, they're number 13. So they missed it by one, but I would still recommend buying potatoes organically if possible. And those that I took it up to 20 for you, just so you know what went up to number 20 on the dirty dozen. And then there's, of course, the clean 15. Well, these are items that do not have the pesticides in them, either because of the way that they're grown or usually the skin over them. If you think about a pineapple, the fruit that's inside is very well protected from anything that's being sprayed on the outside. One of the notes that I did put in here for you for the clean 15 is that there is a small amount of sweet corn, papaya, and summer squash that is from genetically modified seeds. So if you want to avoid genetically modified items from that, just try to buy organic for those particular items. And I gave you the website for the environmental working group, so you can go in, and these are actually, you can print them out and carry them with you to the grocery store if you'd like. Next slide, please. So just, again, a lot of you probably already know this, but how do you tell if it doesn't have a big sign over it, how do you tell if your produce is organic? Well, you look at the PLU, or those annoying stickers that they put on every piece of fruit and every vegetable. If it's a 4-digit number, that's conventionally grown. That is not organic. If it's a 9, if it has a 9 as a prefix, that's an organic product. So you see here in this picture, the 94133 is an organic apple. And then we don't see the 8 prefix very often, but in some areas of the countries, we're starting to see them more. The 8 prefix means that they've actually been genetically modified. So just, knowledge is power, right? Next slide. So there is the question, I get this a lot from my patients and from family and friends, organic costs too much money. Yes, it does. And so one of the best pieces of advice that I ever got was from one of my professors. And she said that if you can't afford to buy organic, then you just do the best that you can. So you wash your produce. And you don't feel guilty when you're eating it. If you think about when you eat something, if you're like, oh, I shouldn't be eating this, this is bad for me, that's really kind of setting up a negative vibe, in your body or in yourself and in your mind. So you just, you wash your produce, you bless it before you eat it, and you go on about your life and you do the best you can. There's no reason to feel guilty about it. If you can't afford it, or you just you're at a place where you can't buy organic. I know I just went on vacation to Tennessee, and I couldn't find very many organic products in the grocery shelves. So next slide. So how should we eat? So I like to emphasize fresh vegetables and fruit. Limit your red meat, and please avoid processed meats if at all possible. Reduce sugar, reduce the carbs. We want anything that's processed, if you can cut back on your processed foods, that's one of the best things that you can do. Refined flours, refined sugars, et cetera, et cetera. I love to use the phrase, eat the rainbow. So when you look at your plate in the evening, is it pale? Is it all white or beige? Do you have like a piece of chicken breast and some rice and some, take a look at it. It should be vibrant. It should be almost a work of art. You should be having some green veggies and maybe some tomatoes or squash or whatever. Make it pretty. And the more of the colorful vegetables that you have on your plate, you're getting more of the good food that's coming from those vegetables. Next slide. So I'm a big believer in the Mediterranean diet. And it's, as I say here, it's not really a diet. It's more of a lifestyle. There's a lot of evidence on the Mediterranean diet for prevention of cancer. There's also evidence base for it to help prevent cancer reoccurrence after a cancer diagnosis. It will reduce inflammation, and it's what I like to call plant forward. Plant forward was a term I heard earlier this year, and I really love it because a lot of folks now are advocating a plant-based diet. And what I find is if we go totally vegetarian and totally vegan, a lot of people can't tolerate that. They really need some animal protein in their diet. Some people I know have questioned my use of the Mediterranean diet because there's dairy in it, but some people can tolerate dairy. It's, it's what, and we can tailor this. This is very easy to tailor for your particular restrictions, dietary restrictions, or likes and dislikes. Next slide. So this is part of when I talked about the blue zone. The research showed that the residents of Italy, Greece, and others had fewer heart attacks, strokes, et cetera, et cetera. This traditional diet was really very plant forward, a lot of fruits, veggies, whole grains. And when I say whole grains, I'm not talking processed grains, I'm talking whole grains, fish, legumes, et cetera, et cetera. They did lots of extra virgin olive oil. They did red wine. Now there is, I'm obligated to tell you, there's a lot of studies nowadays that are saying that any amount of alcohol could be cancer causing, and it could be detrimental to your health. So just know that research is out there. And then in this diet, there's the occasional poultry, dairy, eggs, and the rare red meat, but there is a little bit of red meat in there. And this diet is not restrictive. And calories, you don't have to count calories with this diet. It's the quality and the type of food that you're eating. And this being plant forward really decreases inflammation, and it increases the nutrition of what you're taking into your body. And when we have a lot of inflammation in our body, whether it's from a cancer diagnosis or anything else, whether it's diabetes or arthritis or just living and being more of a sedentary lifestyle, we're going to have inflammation. And we know that chronic inflammation is linked to cancer, heart disease, and autoimmune disease, and many other things. Next slide, please. So this is, I just love this pyramid. It's very colorful. I love the way it looks. If you notice at the top of the pyramid, there's a little bit of meat and a little bit of sweets. And then we get down to the poultry, eggs, cheese, fish and seafood. Then we've got the big portion of the bottom with all the fruits and veggies and greens. And then what I love about this is the area at the bottom, that this is encouraging us to be physically active and to interact with friends and family, enjoy meals with others, make it something wonderful instead of a chore that you have to do. And you'll also notice on the side, because it is the Mediterranean diet, they did include wine. So again, there's a lot of research saying not to do that. And then, of course, staying hydrated, the water's on there as well. Next slide, please. So there's many studies about the Mediterranean diet. I just picked out a couple. That there were about 380,000 people in the United States. They followed them for 5 years, and they simply asked these people to follow a Mediterranean diet and lifestyle. So after following these people for 5 years, women had a 12% decrease of cancer mortality. So that was of passing away from cancer. Men had a 17% decrease from cancer. And then they did another study. This was a randomized all-female trial with 5 years of follow-up as well. And they did, now this is a lot, they did 67 tablespoons per week of extra virgin olive oil plus the Mediterranean diet. And then the control group was simply just mixed nuts plus the Mediterranean diet. And the group with the olive oil had a 68% risk reduction in breast cancers. So that's a lot of olive oil. I don't ask everybody to do that much olive oil, but it's just something to think about. And then as far as our grains, our whole grains in the United States, I always caution my patients to be aware of the number of grains that you're actually taking in, because there's lots of evidence to support that the grains in the US actually have a higher glycemic index. So the wheat products, the pasta, the things that are grown in the United States, unfortunately have a higher sugar content than they do in the rest of the world, particularly Europe. So next slide. Other diets, and I just like people to be aware of these. A lot of these you may or may not have heard of, but if people are going online and looking at different diets, then I think it's important to be aware of these and which ones might be okay and which ones might not. The China study is basically very much like the Mediterranean diet, just a lot of whole foods, a lot of veggies, very plant-based, less amounts of animal protein. So that was cancer preventative. The Kaufman diet is interesting. Kaufman had the theory that if you're eating a lot of foods that perpetuate a fungal infection, that a fungus could be contributory for developing cancer. There is some evidence that supports this hypothesis, but I still see it online as something that people will follow. And I do have patients come in and say they're following the Kaufman diet. I'm not sure whether I am actually convinced of this, but I want you to know about it. A lot of people talk about keto. I will tell you that a lot of the keto diets that are out there right now aren't truly keto. People are not going into ketosis, but the idea behind keto is a good one. It's low carb, rich in natural fats, low to moderate protein. And we know that ketone bodies in some cancer cells can be toxic to those cells and kill the cancer cells. And it is pro-killing, programmed cell death. So when we talk about cancer, cancer is a cell that has forgotten how to turn off. It's forgotten how to die. All of our cells should have a life cycle. They have programmed cell death. Well, cancer cells in a lot of instances have forgotten to turn off. So the ketone diet or the ketogenic diet really helps them turn off in a lot of cancers, not all cancers. My thing with the ketogenic diet is that it's hard to maintain, and I don't think that this is a diet that's sustainable over a long period of time. The only time I tell people to consider the ketogenic diet is when they come in to see me with very advanced cancers. Next slide. There is intermittent fasting. I'm sure you've all heard about intermittent fasting. It has the similar types of effects as the ketogenic diet. And we know that calorie restriction in a lot of studies can decrease cancer by over 50%, and it lowers aging-related deaths. Now, again, intermittent fasting has gotten a lot of, there's a lot of things. You can go on the internet and find 25,000 different people with information on intermittent fasting. I do ask people to start out in a very gradual way to do what's called a 12-12, 12 hours of eating, 12 hours of not eating. That's what we normally do anyway, if you think about it. You go through your day and you eat breakfast, lunch, and dinner, and then you go to bed, and then you have about 12 hours where you're not eating. And then I like to build people up to maybe doing a 16 hours of fasting and 8 hours of eating. And during that fasting time, I'm very concerned about people having low blood sugars. So I will have people make sure that they can drink any non-caloric liquid. They can do black coffee. They can do teas. Of course, water, lots of water. But sometimes I'll have them, if they're prone to having hypoglycemic episodes, I'll have them sip on some bone broth just to make sure that they're not going into a blood sugar crisis. The rest of the diets on this slide are not recommended. The Budwig diet, there's some information about these diets, Gerson therapy, Kelly metabolic, and all these other ones here. There's a plethora of reasons that they're not recommended. I just wanted you to know about it. Next slide. So this is just information about specific foods. There's a whole lot more information. I just picked out some select ones. But things for you to know that with colorectal cancer, for example, dietary fiber and dairy actually decrease the chance of colorectal cancer. Processed meats, red meats, and alcohol will increase the possibility. The same thing with breast, esophageal, etc. Alcohol increases. Liver cancer, coffee decreases. So coffee is not the bad thing that we used to say it was. Coffee actually, particularly if it's organic coffee, and you're not putting a lot of stuff in it, it actually can help prevent some cancers. Stomach cancer, salted foods like country ham and things like that increases. And then pancreatic cancer, fruits decrease it, and some folate can help decrease that. And then the same with the endometrial cancer. Next slide. So we talk a lot about meat, and I know there's a lot of folks that advocate the plant-based diets. So what is it about meat? Why is meat getting such a bad rap? Okay, so meat has a lot of nutrients for our health. It's an excellent source of all of these vitamins I have listed here: phosphorus, zinc, et cetera, et cetera. Meat is approximately 25 to 30% protein after cooking. And protein is required to build our cells in the body, including the neurotransmitters in our brain. Next slide. So then why is meat pro-inflammatory? It's about the cooking. It's about the way we're preparing the meat. So there's fat and animal muscle. And particularly when we grill, and we all love to grill, we all love barbecue, we like smoked meats, particularly the area of the country where I'm originally from, everything's about the smoking, but they cause fats to be released onto the cooking surface. This fat on the cooking surface produces these PAHs, the polycyclic aromatic hydrocarbons. So that seeps into the meat. The PAHs are carcinogenic. So if you reduce the smoking, and if you're able to wipe away the fat drippings from the grill, you actually can reduce the PAH formation, sometimes by almost 90%. Also, meat cooked at high temperatures forms a dark crust. That's what we do when we barbecue, right? We want that char. We want those grill lines. That's what people from fast food hamburger joints is like. They've got the char lines. That's what everybody wants. And it really does improve the flavor. However, those dark crusts, those char lines, do the heterocyclic aromatic amines, and those are also carcinogenic. So if you cook for longer without searing it, and you use more cooling times, longer cooking and cooling times increase those HAAs. If you use shorter cooking times and more resting time, and you don't char the meat, it will decrease the toxicity. And interestingly enough, there's a couple of really great studies that talk about if you marinate your meat before you cook it, you're actually decreasing the toxicity of the PAHs and the HAAs. Next slide. I know this was about nutrition, but I wanted to add these last few slides in here just to remind you of very important things. Hydration, hydration, hydration. 1/2 your body weight in ounces a day. And filtered water is better than bottled water. Sometimes we have to have bottled water. I totally get that. But even a Brita filter, a pure filter, any of those types of filters are much better than using tap water, because you are getting out some of the toxins that's in the water. We know that if we stay hydrated, it reduces our risk of bladder, breast, colon cancers. And people say to me, well, drinking water is boring. I don't like it. I want to drink whatever. Well, I say, make it fun. Please do something to make it fun for you. I used to have a pitcher that belonged to my grandmother. I would put it in the fridge, put water in there, put filtered water in there, and add a bunch of fruit. I'd put in lemons. I'd put in berries. If it was a really hot day, I'd put in cucumbers and mint. So it made it fun. When I'd open up the refrigerator door, there it was. It made me smile, and then I would pour myself another glass of water. Next slide. Movement. We were never meant to be sedentary creatures, ever. We have to do daily movement, but I ask you, please do something to make you happy. Go for a walk, go for a run. It doesn't have to be a chore. Go for a walk with a friend. We need to be moving. And there was a great study on exercise. This was particular to breast cancer, but there's lots of studies on all different types of cancers and exercise. That they studied 1,300 to 1,500 women, and they all had stage 1, 2, or 3 breast cancers. And all they asked these women to do was to walk 30 minutes a day for 5 days a week. That's it, 30 minutes a day, 5 days a week. And what they found was that there was a reduction of over 54% in any recurrence of that breast cancer, simply for walking that little bit of time. So please go for a walk. Next slide. Reducing toxins, we talk about this all the time. Obviously, no tobacco products, no vaping. I'm really concerned about vaping because of putting the moisture in the lungs along with whatever smoke that we're putting in there. Watch your alcohol intake. Processed meats, buy organic when appropriate. We've already talked about that. Protect yourself from the sun. Obviously, please go see your dermatologist for your yearly checks. Marinate meat before grilling. There's evidence that some of the chemicals in dry cleaning could be detrimental. So I was taught that once you have your dry cleaning done, to set it out in your car or somewhere for, a few hours to let the sun bake the chemicals out of it if you have to use the dry cleaners. And then please use hands-free on the cell phone. There's not any evidence to support that using the cell phone is actually dangerous. But I still see people talking about it. So I just say, try to use hands-free whenever possible. Next slide. Self-care. I love this picture. Self-care, take time for yourself. Choose your activities that are intentional. This goes to what Dr. Hecht was talking about mind-body therapies. It's all about taking care of ourselves and to take that time that we need. Next slide. And then stressing less, self-care and stress less, and try to eliminate, reduce stressors, practice mindfulness, sleep, et cetera, et cetera. Next slide. And then this is just I love the slide about the 4 pillars of health. So I wanted to share that with you, that just move more, stress less, connect deeply with people, and eat well. Thank you so much.
Thank you so much for that wonderful talk, Dr. Colvard. And now we're going to look at these questions. I saw the first one is definitely for you. What is the best way to wash your non-organic vegetables?
Well, I've seen many different things. There's a lot of different vegetable washes that you can buy in Whole Foods and Sprouts. But quite frankly, if nothing else, just use your dish detergent, wash the vegetable really well, rinse it off really well, and let it dry. So there's really no special way, but just making sure, particularly on an apple, for example, get down into where that core is. When you see that white residue, that could be part of the pesticide.
And then this other question, which I think you already answered in your slides, was should everyone be vegan? And my answer to that is no.
And I will agree with you, Dr. Hecht. I don't think everyone needs to be vegan. I don't think, we are as diverse as the world and the universe. Each one of us is different, and not everybody does well on a vegan diet. As a matter of fact, when you're vegan, a lot of times going through chemotherapy, my vegan patients have a little bit more challenge with their immune system.
This other question is for me. It's about L-glutamine. Is it effective for chemotherapy-induced neuropathy in the treatments of cancer other than colorectal? Yes, effectiveness varies, but it can be helpful for other types of chemotherapy-induced neuropathy. Sandy, do you have any other comments related to that?
Yes, absolutely. I love L-glutamine as a treatment for chemo-induced neuropathy, and I use it for every type of cancer. Whenever they use a taxane or some of the other chemos that cause the peripheral neuropathies, I use glutamine, and I use a lot of it. I use it for short term because our body makes it naturally, but we need that extra help when we're going through the chemo.
I also use it for like mucositis too, or if
Yes.
people have sores when they have their chemotherapy. It helps sometimes, not in all my patients.
Right. It does help in some people, and doing like a swish and swallow. I have them gargle it, then I have them swallow it. And yeah, it can help some people, but not everyone.
All right. Are there studies done on the effect of plant-based substitutes for things that are traditionally animal-based, like meat, fish, butters, etc.?
That's a very good question. And I haven't seen anything that really grabbed my attention as far as plant-based substitutes. So I can certainly look into that. And if you'd like to send me a private message or an email, I will look into that and get back to you. But I don't know of anything off the top of my head. Do you know anything, Dr. Hecht?
No, but I mean, is what we were saying before, Sandy, is that, in Italy, where they eat a lot of pasta, they're making it on their own. And a lot of this tofurkey and the stuff is still very highly processed. So I'm always concerned about all the extra additives that are involved in any kind of substitute, whether, it's a substitute for dairy or whether it's a substitute for milk. I usually see that there can be like, 10, 12 different ingredients. So there are now newer brands that have come out that have tried to decrease the amount of ingredients and preservatives. And so, I would just say that not all plant-based substitutes are the same.
I would agree with you. There's one of the things that I was told several years ago is that, most of the tofu that's produced in the United States is so processed that it's just not as good as one would like.
And this one is, how often should people get acupuncture to treat neuropathy? In general, some patients, well, first of all, what I would say is that if you have Medicare, it is not covered under Medicare. If you have some type of PPO, they generally cover about 20 sessions. So your income will determine how often you can come in for acupuncture, unfortunately. You know, in other countries, sometimes people get acupuncture every single day. In the United States, depending on the severity of symptoms, I may recommend it 1 to 2 times a week, or once a week, 1 to 2 times a week, or 1 to 2 times a month. In the beginning, for acute issues, I usually recommend my patients to come in more often. And then, hey, hello, is sparkling water instead of still water okay to consume?
I like sparkling water, but I will say that I wouldn't substitute all of your water with sparkling water, because sparkling water gives us the extra added benefit of making our stomach bloated and a lot of burping and belching and gas. So just be aware of that.
Any data on this excessive use of hand sanitizer? For me, I don't know. Sorry.
I don't know either, but I don't believe in excessive use of hand sanitizers. So I always think a little bit of dirt's a good thing. I think that, are we running out of time, Dr. Hecht?
We are. I'm just going to answer one more question.
Sure.
Can I use L-glutamine as a regular supplement to prevent cancer recurrence? This supplement is not for cancer recurrence. It is for chemotherapy-induced neuropathy.
Right.
So one person wanted to know, is there a way to watch this webinar again? So that's all the time we have.
And
thank you. Oh, go ahead, Dr.
No,
Colvard.
I was just going to say quickly, somebody said, do you treat patients with IBS? Yes, I do. So come see me.
Well, thank you so much, Dr. Hecht and Dr. Colvard, for your fascinating presentations. We will do our best to follow up with any unanswered questions with you all, and we will be sharing the recording of this webinar as well. So thank you very much. And then in closing, if you haven't yet already, we do invite you to join the 2022 UCI Anti-Cancer Challenge, which is our annual peer-to-peer fundraising event where participants sign up to ride, run, walk, or volunteer and raise money for cancer research. We do work with corporate partners to underwrite the cost of the event, so 100% of the funds go directly to cancer research at UCI and Chalk Children's. We've had 9,300 participants sign up since 2017, raised more than $2.6 million for research. Next slide, please. So we're very excited to announce that the 6th annual Anti-Cancer Challenge will take place on Saturday, October 8th in UCI's Aldrich Park. It will be a hybrid event with opportunities to participate both in person and virtually. In-person challenge day will include a 5K, 10K run walk, a 14, 35, 60, and 100-mile bike routes, entertainment, a big family-friendly festival, and awards. And we're continuing on with our monthly educational webinar series featuring renowned faculty like those who presented today. Next slide. So we do hope that you'll consider starting, joining, or supporting a team. And again, all proceeds support promising pilot studies and early phase clinical trials that can help prevent, treat, and cure cancers. Next slide. And please join us next month on Thursday, September 22nd, from 1 to 2 p.m. for a webinar on neuroplasticity. Next slide. And if you'd like to sign up to receive webinar reminders and anti-cancer challenge news, please scan the QR code on the screen or visit the website listed. So again, thank you so much for joining us today and have a wonderful day.